Thank you for joining me for this presentation for population at risk, including suicide prevention. My name is Jessica Copley. I'm an LPN to BSN student at Indiana State University. After this presentation, the observer will understand how suicide impacts the United States. They will identify risk factors for suicide, identify warning signs of suicide, be able to identify protective factors, discuss how family and friends can assist those suffering from suicide ideations, as well as be able to share information on who to call for help. At this point, please pause the presentation and take the pretest to see where you're at, and then join back in. Thank you. Important statistics to note are that 1 million deaths are due to suicide yearly in the world. 38,000 of those deaths are in the US. It is a third leading cause of death between the ages of 15 to 24. The highest rate are males, 65, including white males greater than 85 being the most vulnerable. Being able to recognize warning signs is the best prevention. Following the acronym IS, PATH, WARM helps friends and family to recognize warning signs and take the first step in preventing suicide. Warning signs that fall under the acronym IS include I for ideation, which are suicidal thoughts, and S for substance abuse, because oftentimes you'll see an increase in drug use. Warning signs that fall under the acronym PATH include P for purposelessness. Oftentimes they state they have no purpose in life. A for anxiety. They experience increased worry, ruminating, difficulty concentrating, and increased psychomotor agitation. T for trapped. They feel trapped and no way out but death. And H for hopelessness. They feel hopeless and they don't have anything to look forward to. Warning signs that fall under the acronym WARM include W for withdraw. They start isolating themselves from friends and family. A for anger. They act in rage or seek revenge. R for recklessness. They start to take risks and they just don't care about the outcomes. As well as M for mood changes. You'll see dramatic mood changes prior to suicide. Risk factors include a family history of suicide, history of child maltreatment, previous attempts, being clinically depressed or have mental health disorders, having alcohol or substance abuse, feeling hopeless, having aggression, there being an epidemic of suicides, the feeling of isolation, having illness can oftentimes lead to increased risk of suicide, having access to lethal methods, as well as being unwilling to seek help. Protective factors to assist in those with suicide ideations include clinical care for mental, physical, and substance abuse disorders, as well as easy access to interventions and support. Having family and community support is really important, and having ongoing medical and mental health care. Having important life skills, including problem solving and conflict resolution, helps decrease the likelihood of suicide, as well as cultural and religious beliefs that discourage suicide. They're more than likely thinking about not performing suicide because of their religious or cultural beliefs. It's important to seek help if you're having suicide ideations. There's a national suicide prevention hotline. You can call 1-800-273-8255. As suicide risk increases in the military, there's a specific number to call, and that is 1-800-273-8255. Please reach out to a friend, family, or one of these hotlines. There are many resources to help reduce suicide risk and be able to recognize it in friends and family. You can take a look at Suicide Prevention Lifeline, the American Association of Suicidology, Suicide Prevention Resource Center, Suicide Awareness Voices of Education, the Suicide Prevention Hotline, as well as American Foundation of Suicide Prevention. All these resources educate on the importance of looking out for warning signs, understanding how to help those in need, as well as recovering from loss and grief after suicide. But also it can be a great resource for those with depression, those maybe thinking about suicide, and to see if you need to reach out and seek help. Thank you. Please at this point take the post test, and you're welcome to print out the outline that's available to you. Thank you.